February is the deadline to enroll in health insurance coverage through the Affordable Care Act. The latest numbers from the Centers for Medicare and Medicaid Services show hundreds of thousands more Texans enrolled in ACA coverage this year. It's happening despite the expiration of federal subsidies that lower the cost of ACA premiums. Joining us now in the studio to talk about these trends is Charles Miller. He's the Health Policy Director for Texas 2036. Welcome, Charles.
Thanks for having us on. We're always happy to talk about this.
We are always happy to have you guys on. So talk about enrollment. It's up this year compared to last year. So what are the metrics and what are the numbers?
Right. So we're seeing about 4.1 million Texans have selected a plan on the Affordable Care Place market. And that is up by about 150,000 compared to this time last year. Now, we won't know for sure if the effectuated enrollment is up until February. And the difference of infatuated enrollment is that means when people who have to pay a premium, once they have actually done that, that's when we'll get those final numbers there in February.
All right. And so what was your reaction to this? Because nationwide, the numbers are down.
So we are really excited to see this. And I would say to the viewers, today is the last day. Go check out, go see if you can get a plan for you. The big thing that we want to say is while those premiums have gotten more expensive, there is still really good value for a lot of Texans out there. So for anyone making less than 200% of the federal poverty level, and by way of comparison, that's about $30,000 for an individual, about $60,000 for a family of four. If they're making less than that amount, there is a free plan available to them on the individual marketplace.
Oh, that is good to know.
So definitely want to see that. And we think that the availability of those free plans is why we're continuing to see enrollment growth. So prior to this year, there was over 1 million folks who were uninsured who had access to a free plan, along with about 3 million of last year's enrollees who also had access to a free plan. So that's, we think, one of the biggest reasons why we're seeing that continued enrollment growth. But another part of the story is a surprising bipartisan health insurance win in Texas. Back in 2021, Senator Nathan Johnson and Representative Tom Oliverson passed a bill that made bronze and gold plans more affordable. They did this by bringing in extra federal subsidies through some rate review legislation. And this is why we think that Texas might be seeing enrollment growth where other states are not.
Interesting. Any other reasons perhaps behind this growth?
We think that those are really the two big ones involved. But again, part of that is going to be that Texas did have one of the largest uninsured populations out there. And because so many of those uninsured folks in Texas were eligible for plans but did not know about it, we think that there was still room for additional growth in Texas that might not have been available in other states.
So we had nowhere to go but up.
That's right.
And you talked about other states. How did we compare to other states?
So Texas is one of the highest enrollment states in the country. Part of that is because Texas has not expanded Medicaid, so we have more individuals who would be eligible for Affordable Care Act plans than other states. But we do see really, really high enrollment in Texas compared to other states, and we have also seen enrollment growth this year compared to other states. So while we did have a lot of room to improve, we have been seeing consistent improvement in Texas, and that's a great sign.
And we'll see by the end of the day, right?
That's right.
How many more people will sign up?
The end today is the last day to sign up. So again, go check, go see what you're eligible for, and get those applications in.
And if you're eligible for that free program, sign up.
Absolutely.
All right, Charles Miller with Texas 2036. Thank you so much, and we will be right back.